in your center, in Center of Sight, what are all the advanced care that you have introduced now, given all this increase in the diseases that we're seeing?
Well, Center for Sight has always been, I would say, the go-to place for technology, for anything that is advanced or anything that is giving better outcomes. So, from a perspective of we say ourselves as talent, technology, and trust. So, from a talent perspective, I think we have the best of the doctors. When we started being, I would say, AIMS graduates, AIMS postgraduates, AIMS ex faculty, and we have lots of them who were my colleagues or even my teachers or even my juniors who joined, and we have worked as a super specialization. We went out and did not project ourselves as cataract clinics. It was super specialization. So I don't know, the audience may be amazed, or you even may be amazed, that there are about 12 to 14 subspecialties within ophthalmology. Okay, so you have doctors who are specializing in
Just
even
retina alone.
cornea, even contact lens,
Uh,
even lens, pediatric cataracts, etc. Squint.
what are you talking about? Pediatric cataracts.
Yeah, children can be born with cataracts. So basically, you have glaucoma clinic, you have medical retina, you have surgical retina, you have neuro-ophthalmology. So we had a collection of the best of ophthalmologists. And as regards technology adoption, we were possibly the first to get in the stitchless surgery that is called as phacoemulsification
For cataract.
for cataract surgery. We were
What do you mean by stitchless surgeries?
Uh, okay, let me just complete. So from there, whether it be LASIK, we were the earlier pioneers to get in LASIK into India. Then there came customized LASIK, wavefront guided LASIK. Then came blade-free LASIK. Then came the lenticule extraction in LASIK, injections for retina, new type of intraocular lenses. So you name it. So we have been kind of leaders or pioneers in various technologies that have been there. Now the question that you asked me was what is the stitchless cataract surgery.
Cataract.
So
But
as I told you,
before that, you explain what cataract
what cataract
was.
is. Okay, I'll just explain it again.
Huh.
So basically, when you're looking at the eye, as I told you, the light goes through the cornea, it bends, and then it passes through the clear transparent lens, which is right here. And as I told you, if this lens becomes opaque, it's like your hair going gray, right? So the proteins within the lens get denatured with age. And again, given a long enough life, all of us will develop a cataract. Okay, there's nothing myths के आप ये दवाई डाल लीजिए, homeopathic scenario or Ayurveda or Drishti or whatever it is, it does not stop or retard the progress of cataract. Now, what this lens, if it becomes opaque, this will stop the light from going in, and this will not reach the retina. So now what you have to do for this lens is that this needs to be taken out. And this has to be replaced by an artificial lens which comes and sits exactly at the same place. Okay. So this is a clear transparent lens which is put at exactly the same place. Now, when you were doing earlier the cataract surgery, this lens was removed, or this opaque lens was removed as a single piece. Okay. This was called as intracapsular cataract extraction. That means there is a capsule which surrounds the lens. So if you imagine, say, a mango or any phal, any fruit, it has a covering, like a coconut has a covering. So the entire thing was taken out as one single piece. So that was called as intracapsular cataract extraction. And then the person was made to wear thick glasses, because this has a power, the lens has a power. So then the people, if you have seen old movies, etc., so you had people wearing thick soda water kind of soda glass lenses, which were like a +10 or something like that. Then what came was that you remove this cataract and you leave the outer covering, that means the capsule, and then you implant a lens in there. So this was called as an IOL, intraocular lens. That means that you are putting a lens within the eye. Okay. and you used to remove the cataract as an extra capsular. But the main bulk of the cataract, the nucleus was a single piece.
Mm.
So if you have to remove something which is big, you needed a bigger incision.
Mm.
So the incision was about 22 millimeters,
Mm.
20 to 22 millimeters for you to take out this lens as a either as an intracapsular or even an extracapsular. It shrunk a little bit, but still it was a large incision. Now what happened was that uh, this guy was called a maverick, uh, Charles Kellman. So in the 60s, he said, "Can we break this cataract into small pieces and suck it out?"
Mm.
Okay, so the word that came in was phacoemulsification. So phaco means lens in Greek, and emulsification means like in Big C, you are emulsive. So you're making the lens into an emulsification.
Mm.
So, and you are sucking it out. So, therefore, the incision through which you put a needle, which is oscillating or moving at the speed of sound, it's not ultrasonic, but it's moving at the speed of sound. That's why we call it as ultrasonic phacoemulsification. So, it cracks the nucleus into small pieces. There is constantly fluid coming into the eye, and it is being sucked out gently. Okay, so the incision shrunk. So the incision came down to 3 millimeters. Nowadays we work on even 2 millimeter incisions. So you are able to put a titanium needle, break the cataract into small pieces, and without letting the globe collapse, you are also sucking it out. So stitchless surgery.
Mm.
Okay. Apart from stitchless, we can now do these surgeries only with drop anesthesia. Earlier, people were put to sleep.
Correct.
Under general anesthesia, the surgeries were done. Then it moved on to local injections. There used to be an injection given here and an injection given here so that the eye person is not able to squeeze or the lids, etc. But now we do it just under topical anesthesia. Topical means drop anesthesia. So if you do it under drop anesthesia, you don't need to tie a bandage. Because if you had given an injection here, the movement of the lids was paralyzed for 6-8 hours. So you needed to put a bandage. Okay. So you don't need a stitch, you don't need any injection, and you don't need any bandage. So it has become a walk-in, walk-out surgery. No stitch, no injection, no pad, cataract surgery.